Thank you for allowing me to present my work. My name is Shelja. I'm one of the urogynecology fellows in the United States. And my presentation is entitled Mind Matters, Psychological Factors During Pregnancy Predict Postpartum LUTS. These are our disclosures. So pregnancy is a time of substantial risk for women to develop lower urinary tract symptoms, or LUTS. However, there exists an opportunity to promote bladder health secondary to increase health compliance. Many medical and psychosocial comorbidities are associated with LUTS, including diabetes, hypertension, cardiovascular disease, depression, anxiety. However, the perinatal period specifically remains understudied. We sought to answer the question, what perinatal psychosocial factors predispose women to experiencing LUTS postpartum? Participants were recruited into a longitudinal study evaluating group prenatal care at 4 sites in the United States. They completed LUTS surveys at 2 time points, in the second trimester, and then again 12 months postpartum. Items assessed included sociodemographic characteristics, clinical measures, delivery mode, depressive symptoms, perceived stress, resilience, and social support. LUTS measures included self-reported urinary frequency, urgency, stress and urge incontinence, nocturia, and pain. In our secondary analysis, we used bivariate and multivariate logistic regressions to assess associations between sociodemographic characteristics, psychosocial factors during pregnancy, and LUTS 12 months postpartum. We had a total of 475 participants. Of those, the majority identified as Black, were ages 18 to 25, and were primiparous. The majority delivered vaginally, and over 1/3 of our participants were obese. So greater than 50% of the participants reported 1 or more LUTS symptoms 12 months postpartum, and 30% reported that they had no bladder symptoms whatsoever. Within the models that included race, age, BMI, and delivery mode, we found these associations. Those who reported any postpartum LUTS were more likely to have reported a higher level of depression when compared to having no LUTS at all. Reports of increased level of nocturia were associated with higher levels of perceived stress and everyday discrimination at baseline. Those reporting decreased levels of nocturia also reported a higher level of social support. And finally, the psychosocial factors that we queried were not associated with specifically stress or urge urinary incontinence at 12 months postpartum. The strengths of our study include measuring psychosocial and environmental factors in addition to more traditional sociodemographic and clinical characteristics. Additionally, we explored a range of LUTS, not only incontinence, in our diverse population. However, given our desire to query the spectrum of LUTS in just a few questions, our limitations included use of unvalidated items, though they were adapted from existing validated questionnaires. In conclusion, perinatal depressed mood, social support, stress, and resilience were associated with experience of LUTS at 12 months postpartum. The study identifies novel associations between psychosocial and environmental factors and postpartum LUTS, particularly nocturia. Qualitative exploration of postpartum nighttime voiding behaviors could identify opportunities for improved screening and intervention. Thank you, and I will take your questions now.
So can you go back to the last slide? Not the reference one, but maybe the person. So can you finish the sentence on the last bullet point? So the exploration of nighttime voiding behaviors could identify opportunities for improved screening and intervention of what?
Of bladder health, prevention, and lifetime bladder complications.
What about depression? I mean, does it work the other way? That this may be a marker?
Absolutely. I mean, based specifically on the data that we just had association, so it can't be conclusive that one is causative, but based on other research, of course, I'm sure it would affect the depression.
I mean, I was just trying to figure out on that conclusion what the impact was.
Oh yeah, so I mean, from the conclusion we can draw from this study is that just exploration of what the normal behaviors are, in addition to those who have these support systems, don't have support systems, what the differences are, could help identify what kind of advice we can give pregnant patients on what to look out for after pregnancy.
Did I understand it correct that you did ask the questions during pregnancy as well?
Correct. So
The
in the
LUTS and the
second,
depression, and did you have the same relationship during pregnancy? Were there any difference, or you didn't?
so we asked the depressive questionnaire was given during pregnancy, and
But not the LUTS.
correct. No. But LUTS was given at both, but depression
Yes.
was given during pregnancy only.
Yeah.
So it's
right.
correlated to during pregnancy,
Yeah, right.
psychosocial to post.
So then my question is not that, but if what was about the LUTS during pregnancy? Was there any relationship between LUTS during pregnancy and afterwards?
We did not do that analysis yet, but
Okay,
that is
because
something we
it
can
would
look
be
into. Yeah.
something.
That would
to-
be, yeah.
All right, any other questions? Thank you very much.
Thank you.